So this is what we're going to look at today's new field workers, review of regional conferences, bit on training, some news on the Doctor's Life Support book, new national movements, diploma courses, and the World Congress. We're going to move quite quickly through all of this. But first of all, a welcome to, we've got 5 new field workers since we last met in May. And 3 of them, I think, are with us today. So Andrew Oishi is joined the Oceania team based in Hawaii, covering Polynesia. Irina Arundis is based in Turkey and joins the Eurasia team, covering Turkey and Georgia. Irina Hushka is also joining the Eurasia team. She's based in Belarus, and Irina is the one who every single day puts out the prayer request on the WhatsApp group. So you can thank her for that, but she's joining us as a field worker as well. Marcella Zabayos from South America. She's covering Peru, Ecuador, Bolivia, and Paraguay. She just joined the South America team. And then finally, Yamin Khan is our new area representative for Pakistan, joining the South Asia team. So you're all really welcome. All 5 of these are area representatives, ARs, and we hope to meet them all in person at the Jakarta conference later this year. So welcome to you. So it's been the year of regional conferences. Every 4 years, we have a year of intense regional conferences, and it happens to be this year. There have been 12 run so far around the world, and just some quick views on that. So it kicked off with the Eurasia team in Moldova back in March, and then the East Africa Conference in Rwanda. And then the Eurasia team also had a regional conference in Central Asia in Tashkent. And then Southeast Asia Leaders Conference in Malaysia. The East Asia Conference was in Ishigaki, a place I've never heard of before. I visited in Japan, but just east of Taiwan. And then this was the Portuguese World Congress in Brazil, just recently, earlier this last month. And then there was the Middle East North Africa conferences in Cairo, Egypt, just the leaders there, the Southern Africa Conference in Zambia, right near the Victoria Falls. And then last of all, we've just come back from the Francophone World Congress in Burundi, where we had about 180 people from 18 countries there. So it's been a wonderful time of fellowship and people being able to meet in person. We're so grateful that COVID is over and that this can all happen again. Now, if you've been involved in ICMDA for a while, you'll know we've got 5 or at least 9 strategic priorities that we're working through at the moment. I'm just going to talk about a few of these. But firstly, training tracks or training programs continue, where we've now run 215 webinars. We have the training tracks are now in their 9th 6-monthly generation, with over 150 of those 10-week training tracks happening. And there are 22 of them running this semester on a variety of different topics. We also have the saline process training is ongoing. We've now got 32 multiplying trainers around the world. We had none 5 years ago, so that means we're able to do a lot more training. And then there's the disciple making ministry, which is happening all over the world. So we just give thanks for the 215 webinars that have happened. They're all available on the website still with associated resources. And then the training tracks, the main ones, bioethics, confident Christianity, Sydenham, and servant leadership, but a number of other topics now have been added to those. And I'm sorry about the red lines. I'm not quite sure what those are, but anyway, you can ignore them. But our 14 regions, we've divided into 4 training clusters of 3 or 4 regions each. And each of those training clusters will have a lead person or facilitator for every training track we have. So for example, in ESO region, which is East, Southeast, and South Asia and Oceania, we will have cluster coordinators for Sydenham, for bioethics, for confident Christianity, for servant leadership, and so on, for saline and so on. I'm in the process of appointing these people, and many of these are of course already field workers wearing two hats, and we're going to move to appoint more people into these voluntary positions so that we can really take our training tracks forward. And then on to resources. I think the big news is the Doctor's Life Support, which is our daily devotional. Of course, version 5 was published and available at the World Congress in Arusha last year, but we've now completed 4 of the language versions, Spanish, Korean, Chinese, and French, and they are now available either in digital copy or in hard copy. And it's just been amazing to see how hard the regional teams have worked producing those and then printing them. And we've got 4 other translations underway in Arabic, Portuguese, Russian, and Indonesian, and they are ongoing. But we've already started commissioning for Doctor's Life Support 6, which will come out at the next World Congress in South Korea in 2026. So we're very thankful to Sarah and Steve who commission that and do all the editing for us. And of course, the many people who write devotions. And you can get the devotions daily. DLS version 4 is available from the website. You just have to sign up with your name and email, and we'll make sure you get that every single day. There's about 1,400 people who get it at the moment. So moving on to new movements. As you know, we've got 6 main target areas where ICMDA is pioneering. That's the Caribbean, Middle East, North Africa, the Balkans, Horn of Africa, Southeast Asia, and the Pacific. And so particularly the blue and the gray countries are where we have only individual contacts or no contacts at all. In the gray countries, the orange ones are those where we have national groups that are moving towards affiliation, but not yet fully affiliated. So we've got 107 affiliated national groups. And it's amazing the new contacts we've made just in the last year and a half. These 20 countries where we had no contacts with Christian doctors or dentists 18 months ago, we now have contacts and groups are starting to form. So we really thank God for our hardworking field workers doing pioneering, making these contacts and visiting these places. And then the diploma courses. You're aware that we've been running a diploma in family medicine in English for the last 5 years. And we have now had over 190 students involved from 50 countries in this diploma. And the first 3 groups have graduated. There are some who've still got practical requirements to complete before they get their certificate. And the 4th and 5th cohorts are well on the way. So that's been happening for some time. And then you can see on the map here, the darker the country, the more people. So particularly Nigeria and Cambodia are leading the way, but about 50 countries altogether have had students do the Diploma of Family Medicine in English, the 2-year diploma. And we've just the last 2 weeks had our contact programs where they've gone to 5 centers around the world to learn practical skills. And here you can see the picture just from the last couple of weeks from Cambodia on the left, then Uganda, and then India, Christian Medical College for Law on the right. But the big news is that we're launching this diploma now in 3 new languages. That's French in January next year, Russian in March next year, and Spanish in May next year. And we're in the process of appointing 3 regional teams, each of which consists of a part-time academic coordinator and a full-time administrative coordinator. Interviews took place yesterday. There'll be some more on Monday. And the translation of the course material, the equivalent of 15 300-page books, is well underway. We're on course for that, along with 30 hours of video, and we are on target to launch this. And so we've also established contact centers in 5 different countries, 2 for French, 2 for Russian, and 1 for Spanish. Those are underway. And our hope and dream is for an initial cohort for each language group of 20 students. And there are going to be scholarships and travel grants available. And bookings for those courses will open fairly shortly. The French will be first in October. It'll open. And then there will be followed by the Russian and then the Spanish a couple of months later, following after each other. So do look out for those. There'll be a lot more news on it, publicity, and we're really excited about these programs being available in these 3 new languages. We're also launching a new diploma in healthcare management next year. It launches in February 2025. Again, this has been written from scratch, and progress is really good. We're on target for this. And applications for this will probably open either in December or January. And this is for people who are involved in administrative work in mission hospitals or church hospitals or in the community. We're very excited about this program. We're hoping to have 50 students in the first stream starting in February from all around the world. This course will be in English, but we hope that will be available in other languages in years to come. And then just finally, just a reminder about the World Congress in South Korea coming up 30th of June to the 5th of July in 2026. And that's going to be hosted jointly by our 2 Korean movements. We're expecting over 1,000 doctors, dentists, and students. So put that date in your diaries. We're building a bursary fund of $250,000 to help people to come to this from resource poor nations. And the planning committee has met several times. We've confirmed a main speaker, and the website is largely designed and underway. So do keep praying for that event. I know it's 2 years away, but the time to start planning for it is now. So there's an update, fairly quick, of some of the major highlights since we last met in May this year.